Hello, and thank you for having a look at the Cleft Lip and Palate module for Health Talk. Cleft lip and palate is a common condition and affects around 1 in 700 babies in the UK. There are different types of cleft, from a very small gap in a lip to a cleft of the whole lip and whole palate. So families and individuals affected by a cleft will have their own unique story to tell. Families and individual users of cleft services from all over the UK were interviewed, and they have told their stories for the development of the Cleft Lip and Palate module. These experiences of cleft lip and palate have been summarised to provide a resource not just for families and individuals affected by the condition, but also health professionals to gain a better understanding of living with a cleft and how we can all work together to further improve cleft services in the UK. There are 11 treatment centres across the UK where a team of specialists work with babies, children and adults who have a cleft. Surgeons repair the cleft lip and palate, nurses help with feeding babies and generally act as a bridge between the families and the cleft team. Speech and language therapists diagnose and treat any speech difficulties. Orthodontists straighten teeth and prepare teeth and jaws for surgery. Psychologists, who are the newest members of the team, can offer help and support for parents before the birth if a cleft lip is diagnosed antenatally. They can help after the birth and at any point for children and adults who have psychological or social issues. The treatment pathway can start before birth if there's an antenatal diagnosis and carry on for more than 20 years. Sometimes a cleft of the palate is diagnosed late. This can be very distressing for parents, as an undiagnosed cleft can cause lots of feeding problems for a baby. This problem has been recognised, and more training and raising of awareness amongst health professionals is taking place, so that hopefully cleft palates are not missed. In general, feeding a newborn baby can make parents very anxious, but every centre should have a team of cleft nurse specialists who will visit usually within 24 hours of birth and help with feeding. Mothers and fathers talk about feeding their baby in the feeding topic summary. Recent research has shown that speech, although a problem at first for some children, can be treated very successfully with further surgery, perhaps 20% of children with a cleft palate, and/or speech therapy for 50% of children with a cleft palate. Parents and adults with clefts share experiences of surgery and speech and language therapy in the topic summaries. The topics included in this module provide information based on experiences of living with a cleft, including diagnosis, feeding, treatment, emotional impact and support, social interaction and public awareness, as well as the experiences of adults born with a cleft. The outlook for individuals with a cleft in terms of appearance, function and well-being is much brighter than it was a generation ago. Indeed, people born with a cleft need not be held back in life, as you will appreciate by viewing the topic summaries on this module, particularly education, career and lifestyle. Finally, you can find information about other organisations that support families and individuals affected by cleft in the resources and information section of the module. Thanks again for looking at the Cleft Lip and Palate module.